My name is Louise Carlsen and I'm a medical doctor at the Danish Headache Center. Today I will talk about how we can diagnose medication overuse headache. Try to imagine a patient having a severe migraine attack with nausea, vomiting, and sensitivity of light and sound. How would you advise this patient? I would suggest to relieve the pain and all the discomfort by taking some painkillers or migraine medication. Then, over the next month to years, the migraine attacks get worse with longer duration and higher intensity, and they occur more and more often. But the patient still needs to manage the work, the social life, and the kids' soccer games in the weekend. How would the patient manage now? Well, probably the patient still would try to relieve the migraine with painkillers. But now the painkillers don't work as well as they used to. Actually, the patient is never totally pain-free. The patient starts to cancel appointments with friends and families because it is unpredictable when the next severe migraine attack will occur. And the patient never leaves home without painkillers in the bag. The patient is feeling sad and anxious most of the time. The headache takes control over the life. Finally, the patient seeks your help. Well, this could be a typical history of a patient with migraine developing medication overuse headache. What characterizes medication overuse headache? In the beginning, the painkillers are effective and only used from time to time. Over time, the more and more frequent use of painkillers causes a chronification of headache. The cure becomes the cause. A vicious circle has begun. The pattern of the headache becomes more unclear with more frequent migraine-like attacks. The headache becomes difficult to treat, and most patients are never completely pain-free. The analgesics or migraine medication don't work as well as it used to, and a substantial number of patients show symptoms of anxiety and depression. Now, let's have a look on the medication overuse headache diagnosis. Medication overuse headache is diagnosed according to the International Headache Criteria. It is a chronic headache, which means that headache occurs at least 15 days a month for a period of minimum 3 months. Far most people who develop medication overuse headache have a pre-existing headache. Migraine and tension-type headache are the most common pre-existing headache forms. But medication overuse headache can, in principle, be developed based on all kinds of pre-existing headache forms. It is a secondary headache due to overuse of acute medication and/or migraine medication. And overuse is defined according to the type of analgesics. For simple analgesics, it is an overuse when used for more than 15 days per month in at least 3 months. For all other drug classes, or combination of drug classes, including combination with simple analgesics, used for 10 days or more a month, is defined as an overuse. The diagnosis is specified according to the type of analgesics overuse, and more than one subtype of medication overuse headache can be given. It is also important to underline that patients can have more than one headache diagnosis. For example, a patient fulfilling criteria for chronic migraine and for medication overuse headache must be given both diagnoses, chronic migraine and medication overuse headache. So, what causes this paradox of headache and painkillers? Somehow, patients with headache seem to be more prone to exposure of long-term analgesic use. The condition was already described for the first time back in the 1930s by Lennox. He observed that ergotamines caused shorter intervals between migraine attacks in his patients. Ever since that time, many colleagues, including Peters and Horton, have described similar cases and tried to solve this paradox. Among others, genetic predisposition has been pointed out as a potential risk factor for developing medication overuse headache. Also, imaging studies have found anatomical, functional, and metabolic changes in patients with medication overuse headache. But these changes did not seem to be specific for the condition. Moreover, electrophysiological investigations have shown that patients with medication overuse headache develop central sensitization. This may lead to a lower limit for triggering the next headache attack. Importantly, these changes are almost normalized after treatment. But many pieces of the puzzle remain to be identified, and further research in the field must be done. Today, more than 60 million people worldwide have medication overuse headache, twice as many women than men. So it is a common disorder that causes a high number of years lived with disability. And the highest prevalence is found in the ages from the mid-30s to mid-60s. Medication overuse headache is important to recognize and diagnose correctly because it can be treated. In the next video, treatment options will be discussed. Thank you very much for your attention.